All right, thank you so much for staying with the Monday Report. The discussion is still going on even on Twitter. There's a lot of feedback coming through. We'll read some of them and also make sure you can see some of them underneath our screen there. We are asking you whether to reopen the economy or not. And Dr. Lukoya Tuoli is still with me. He's the Vice President, Kenya Medical Association. Dr. Githinji Gitahi, CEO, Amref Health Africa, is also with me still. Vincent Mungai says the economy is on its knees. Opening it is necessary. However, the government should do more to prevent transmissions as numbers are going up. It is also sad that politicians are playing tricks by distributing poisoned food. And we also have Tawakkal Khalif. Says the government should reopen the economy and we should learn to live with the virus as it's becoming our new normal. Dr. Githinji, and this is something I hear a lot because even the WHO has said that this virus may be here to stay. And most Kenyans are saying that we should just open the economy and let the chips fall as they may.
You see, and Kenyans are right. The virus is going to be with us, for a long time. As Professor Lukoya was trying to explain, that until you get a vaccine to interrupt transmission by giving people immunity against it, it's going to be with us for a long time. Therefore, this is what people heard about WHO saying it may be endemic, meaning it's going to be with us just like malaria is with us, generally. I think, what we need to ask ourselves is, as we live with the virus, what is it we can afford to live with and what can't we live with? Because if we just let it go completely and say, we don't care, open the economy, no restrictions, move on, it is fine. But we have a lot of people who are vulnerable. As you've seen the numbers coming in Kenya now, out of the 52 deaths that we have, the majority of them, I think maybe 16, 17 of them, are in male above 60 years. So we already know that there is vulnerability for people above 60, especially male. I was calculating and I was seeing that 1 out of every 3 men above 60 who are positive have actually died in the numbers that we have. So there is vulnerability. So we cannot wish that away. So as Kenyans discuss this issue of living with the virus, then we have to ask ourselves about what do we do about the vulnerable people? What do we do about those people we need to protect? Now, let me get back to your question that yes, the virus will be with us for long. Therefore, as we think about those vulnerable ones, then we have to think that there are things that will not come back. Even as you say, open the economy. What does open the economy mean? The open the economy may mean, for example, remove the curfew. Fine. It may mean reopen restaurants. But remember that the public health measures, we will remain. A restaurant that was carrying 100 people may not be allowed to carry more than 40. So there will still be a depressed economy even as we reopen it. You will not see conferences and meetings. There may be a limitation of people gathering beyond 15 people. Whether you reopen the borders between Nairobi and the rest of it and Mombasa, these restrictions will remain. So we need to also understand when we say open the economy that you're not saying throw away the public health measures. You're saying open cautiously, as has been warned, and have indicators to ensure that you know when the lights go off or when the lights go on. You cannot reopen without a dashboard. And that dashboard is testing. That dashboard is engaging community health workers and the communities and the facilities to know that you can measure or you know the number of people who show up in facilities with a particular listed symptoms that relate to COVID-19, then you can then test them. But you must be able to tell, is cough going up? Is fever going up? Then you're like, that could be COVID, and then you test it. So we have to have a dashboard as we reopen. But remember, opening the economy is not a blanket opening for everything. The public health measures will remain. So the economy will still suffer for quite some time.
All right. Dr. Lukoya, there's a question here from Uncle Fred Obachi Machoka. He's asking, is it recommended to vaccinate people who are already infected?
So if we understand the immunity, we still don't understand the immunity as well as we should to answer that question fully. But if we did, and if we found that if you get infected, then you have protection for several months or years, then it wouldn't make sense to vaccinate you after you get infected. The vaccination is meant to protect people who have not been infected in order that they do not get the disease, even if they get the virus. And or if they do get symptoms, then the symptoms will just be mild and they would be able to deal with them. That is the goal of vaccination. So it doesn't make sense to vaccinate somebody who has already been infected if indeed getting the infection confers immunity for a long period of time.
All right, there was another question here also on Twitter. They were talking about the issue of nutrition, and it's Mtumishi here. He's saying that how about focusing more on naturally boosting our immunity through nutrition as a strategy of limiting the impact of COVID-19 and getting back to school and to work as well?
I would say that good nutrition is something that we must do with or without COVID-19. People must be educated on what is healthy and what is not, because we are also dying from malnutrition. We're also dying from other things that we do that lower immunity. And people should be educated on how to keep the immunity up, because infectious agents are ubiquitous in our environment. As far as COVID-19 is concerned, that is one of the important things that we would want the population to take care of. Eat well, sleep well, get rest, be physically active, keep your brain busy as well, and so on and so forth. But those will not prevent you from getting COVID-19. Those will make your body better able to deal with severe disease if indeed you do get it. But the definitive thing that we're looking at is try and slow down those infections as much as possible, so that when people are getting them, very few of them are presenting in hospital with severe symptoms that would then overwhelm the health system.
Right.
If we do that, then if it keeps spreading in the population for 2 years, we will be in a place where we can keep handling cases of severe illness as they emerge.
All right. Dr. Githinji, now, the other question that everyone is grappling with, are we ever going back to normal, or is this the new normal? Because there are some people who are saying that, for example, PSV matatus that carry 14 people, it's about time that they removed some of their seats, because we are going to stay at 8 for the longest time possible instead of staying with the 14 and then staggering the people across them. Should we be thinking about that now?
Well, I will speak on my behalf because the things you're talking about may involve the actions the government decides to take. If I was to be asked, I would say yes, the new normal is going to be different from what we knew. Number one is that if you look at just basic life, you look at restaurants, they're going to handle less people than they did before. If you look at matatus, buses, they will carry less people than they did before. And there are also procedures that are going to be put in, or that should be put in, to ensure that you reduce the rate of infection. Some of these procedures, if we do not have a vaccine, it means that hand washing, which is a good practice anyway, with or without COVID, will be encouraged and will be implemented even as you enter a matatu or you leave. Hand sanitizers will be used regularly. Face masks may be used over and over, especially when you're going to public places, because you will need to protect other people if you're coughing and you don't want droplets to land on others or land on the surfaces. So these are things that we probably will get used to, and we need to get used to. And for me, I would advise the government to implement that. Congestion is going to reduce, even in terms of when you go to church, for example. We may require that in church, people stay far apart, and therefore a church that was holding 200 people could now hold 70 people. These are things, until we have a vaccine, we have to work on, because we do not know who is infected, who has developed immunity, who has not. Remember, even when we start traveling and start opening up or having conferences, you can no longer host conferences of 1,000 people, because where do you host them? You will need an entire space to host so many people, because everyone needs to be several distances from each other. When you start to travel, airplanes may require that 3 people cannot sit next to each other anymore. You have a seat in between, which means that costs of travel are going to go up. So these are things we need to think about and prepare for, and that are necessary for us to ensure that the curve that Professor is talking about remains flat until we can have a vaccine to interrupt the transmission.
Okay, and Dr. Githinji, there's Ivali Jr. who's wondering, why is it that our neighbor Tanzania did not take the measures we took, such as lockdown, and yet there was no surge in COVID-19 cases?
I will answer that question by answering the last part, that we do not know whether there is a surge in COVID-19 cases. As people are popularly saying, you only find cases if you test. So Tanzania has stopped announcing since, I think, 29th of April. So we know from what you may call proxy indicators. Like, for example, when you're testing truck drivers at the border in Namanga, we know that there are a lot of truck drivers from Tanzania who are testing positive. So if you just use that as a proxy indicator, then you can tell that the cases are increasing in Tanzania. But until the Tanzania government announces the number of cases, we cannot tell. So the fact that they are not announcing and therefore we don't know doesn't mean they are not there. Now, what I said earlier is that COVID-19 is a statistical issue. So if you have only 1% of your population infected and 20% of those are symptomatic, and you have 30,000 facilities across the country, it is likely you will not notice a surge in symptoms because many people stay home, others go to the pharmacy. But if you now increase that 1% to 10%, the numbers of people seeking treatment for their symptoms increases. That's when you start to notice the surge. So right now, whether in Tanzania, Uganda, or Kenya, it is likely that we are still very low numbers. And as the infection continues, we'll start to see the impact, either in Kenya or Tanzania later, and maybe in Tanzania, the impact may become earlier than Kenya, because we expect that the reproduction rate, the number of people being infected by one person in Tanzania without measures, is higher than in Kenya, where we have measures. So it's just a matter of time.
All right. Dr. Lukoe, Engineer Lazaro Kanyambok is wondering, why can't we just use our energy in recruiting more frontline healthcare workers, more medical personnel? Is this the silver bullet, more boots on the ground?
So it's not either or. The reason why we are slowing down the transmission, one of the reasons why we are slowing down the transmission, is so as to prepare our health system to get better and better at handling more and more numbers. So one of the things we should be doing within these periods of movement restriction is hiring more health workers, obviously, because we want to enhance the capacity of our health system to handle more patients as expected if the numbers keep rising. Another thing that we must do during this period is to get equipment for testing, equipment in the hospitals that haven't had equipment for a long time, to fix the supply chain so that when we need PPEs, when we need drugs and medications, they arrive as soon as we need them, and so on and so forth. So fixing the health system is one of the reasons why countries do those procedures of restricting movement, curfews, and so on, so as to keep the numbers low and help them buy time to prepare the system in case there's a surge when they reopen. So those are some of the indicators that you would want to have in place to say, I am now able to handle 100,000 sick people if they show up. And from my calculation, if I opened up, we will have 80,000 sick people showing up. So we are within capacity. Then you can go ahead and just let people interact freely. But if you do not have that capacity, then you do not have a reason to take that step. So it is a relatively science-driven process that you use data and information that you have to make those decisions.
All right, gentlemen, we are running out of time here, but I'd like you guys to close these remarks by answering this question. What are some of the quick wins that the government should be focusing on right now? Dr. Githinji, I'll start with you.
If I got you right, Trevor, you're asking what I think the government should be focusing on right now.
Yes.
Now, the government should be focusing on the key things I think about. Number one is increasing testing capacity. And remember that testing, when you talk about testing, you need to, somebody told me the other day, there's a reason why robbers rob a bank, because that's where the money is. So test where the infection are likely to be. Test health workers, for example. Test people in hotspots. So increase testing capacity to ensure you capture the people who may be positive. Then what do? The next thing the government should be focusing on is to ensure they have isolation facilities out of the hospital for people who are positive but have no symptoms. That is something that we haven't focused on much, and we need to, because all the people who are positive, even those who are not symptomatic, are being put in hospital, increasing therefore the load for health workers. But if you build isolation centers for people without symptoms outside the hospital, then you reduce the load for health workers. The third thing that the government needs to focus on is continuity of services. We cannot make the Ministry of Health become the Ministry of COVID-19. The Ministry of Health is the Ministry of Health. So we need to strengthen our national public health framework that can continue to deal with infectious diseases like COVID and others, and everyone else goes back to work, because mothers are still getting pregnant, adolescents still need family planning, children are getting pneumonia. So continuity of services is really critical. The final thing I'll say, the government needs to be focusing on creating a dashboard of monitoring symptomatic disease at the ground level, using communities, health workers, using nurses, doctors, to be able to monitor beyond testing in the laboratory, we need a dashboard to monitor symptomatic disease patterns across the facilities all over the country, so that we can see that on a daily basis and be able to see whether there are surges or not, even as we do laboratory testing. Those are the things that will pick up very quickly right now, Trevor.
All right, Dr. Lukoye, please answer this question from Crystal as we close. Crystal is wondering whether the COVID-19 strain in Kenya is different from what we are seeing elsewhere in the world where there are serious fatalities have been reported. Is there an iota of truth in that statement?
There are many strains of COVID-19, but we do not have sufficient information to argue that the strain that is here is weaker or stronger than the strains elsewhere. The demographic and epidemiological data that we are seeing is that in many of the places where there are very many deaths overwhelming the system, the age of the people who are dying is the same as the age of the people who are dying here. They're older and they often have other comorbid medical conditions. And when we say this, it looks like they're few. But in our population, if you look at the so-called vulnerable, they are a sizable number. These are people with diabetes, which would be 2 to 3% of the population, people with hypertension, which would be almost a quarter of the population, or 20%, most of whom do not know, people with cancer, people with respiratory conditions and so on, people with HIV. If you put all this together, then there's a significant proportion of the population that is vulnerable. But those are the people who are most likely to die. The preliminary analysis of the data that we have currently, looking at the people who are dying, the main factor that I can tell you with confidence is that those who are dying are older than those who are leaving the hospital well after treatment. And the second thing is that those who are presenting with symptoms, those who are symptomatic at the point when they are being caught into the health system, also have a higher risk of dying than those who are picked through surveillance and are asymptomatic. So those are some of the things that we are picking up. The data is still very low for us to start comparing with other countries that have 10 times, 100 times more data than we do. But as time goes by, we will be able to answer that question authoritatively.
All right. Thanks for making time for us this evening, gentlemen. Dr. Lukoye Atuoli, Vice President, Kenya Medical Association, and Dr. Githinji Gitahi, CEO, AMREF Health Africa, for speaking to us this evening. Thank you so much for that conversation. To reopen or not, Nelly Chepkemoy is saying the question the government should be grappling with before making any move to reopen the economy is whether the nation will adhere to the guidelines and if it can minimize the damage should they reopen the economy. Very good questions there. We're taking a quick break here on the Monday Report. When we come back, I'll be running you through the sporting action and a few more stories as well. All right, stay with us. Selling a baby for just 3,000 shillings. We tell you where and why after this break.